Welcome! If you're watching this, you're probably exploring solutions for hair loss, or maybe you're preparing for a hair transplant. I know how overwhelming this journey can feel, but I'm here to guide you through the essentials, especially the role of the medication Minoxidil. By understanding how medical therapies work hand in hand with surgery, you'll be much better equipped to make the decisions that are right for you. First, let's clear up a common misconception. Many patients come in expecting a quick surgical fix for pattern hair loss, also known as androgenetic alopecia. But lasting, natural-looking results usually take a combination of both medical and surgical treatments. If only there were a miracle cure, simple, side-effect-free, and guaranteed for everyone. But since we're not there yet, medications are a crucial part of the journey, before and after any surgical intervention. Let's talk about the cornerstone of medical management, Minoxidil. This is probably the most researched and widely used medication for treating pattern hair loss. Fun fact, Minoxidil was actually first developed for high blood pressure. During trials, researchers noticed some patients had unexpected hair growth, so of course they turned that side effect into the main event. Now, we have topical Minoxidil in both solutions and foams, available even over the counter. A 2% solution was used in the late 80s for male pattern baldness, and much later a 5% solution came along, plus a 5% foam version. What does the science say? Clinical studies show Minoxidil can increase both hair count and hair thickness. It works for both men and women by acting on the scalp blood vessels and dilating them, thus increasing the scalp blood flow, and hence nourishing the hair follicles better. Multimodal therapy, where Minoxidil gets added, it boosts the results. I always recommend discussing this with your plastic surgeon or dermatologist. You may even comment below, and frequently asked questions can be answered. The channel is for education, and specific recommendations will not be made. So, where does Minoxidil fit in with hair transplant surgery? It's actually a valuable partner both before and after your procedure. Surgeons often suggest starting Minoxidil ahead of surgery and continuing after. You get two big benefits this way: less post-surgical hair shedding and a speedier growth phase for those newly transplanted follicles. If you're thinking about trying Minoxidil, here are some practical tips. Apply over a clean and dry scalp. For men, 2% solution may be used twice daily, while the 5% foam may be used once. But commonly, most people tend to stick with it better when it's just once-a-day foam. Also, Minoxidil oral medication is available, and it has a good compliance. For women, starting with 2% is a good idea. If you're not seeing the results you want, talk to your doctor about switching to the 5% foam. It could make a difference, especially with less mess and less irritation. No matter your gender, don't just apply it to the crown. Cover all the thinning areas your doctor recommends. Use a dropper for solutions, or your fingertips for foam, and gently massage it into the scalp. Always wash your hands after. If you notice scalp irritation, it might be from propylene glycol in the liquid solution. Switching to the foam usually solves this, since it's made without that ingredient and is generally better tolerated. For surgical patients, perioperative use, meaning before and after your procedure, brings the best results. It keeps follicles active, reduces loss, and helps you see the results: thicker hair and less fall. To sum it up, Minoxidil is a key player in modern hair restoration, used both medically alone and as a partner for surgical management. Consistent use, guided by your healthcare provider, can dramatically improve your outcomes. If you're considering a hair transplant or already scheduled, have a conversation with your plastic surgeon or dermatologist about incorporating Minoxidil into your plan. Thanks for watching. Remember, your journey to hair restoration starts with good information, and now you're ready to take your next step with confidence.